Hey Trib, I hope you all had a healthy and happy and safe holiday weekend. And I also hope that the title of this or subject of this email did not offend anyone. The intention was not to offend anyone, it was actually to just capture your attention so you would actually open up the email. So I apologize if I offended anyone. I completely understand that incontinence is not a laughing matter. In fact, I understand that it's oftentimes an embarrassing topic to bring up and talk to people about. Sometimes it is a very restricting topic in that it's incontinence is restricting and it's keeping people from doing the things that they love doing, hiking and biking and running or picking up their grandchildren, or honestly sometimes just leaving the house or going shopping. I also understand that incontinence is a frustrating topic as well. A lot of times, if you do actually bring it up to a physician, sometimes the treatments are, helpful to a certain degree and sometimes not helpful at all. I know some of the treatments that I typically recommend are for incontinence are strengthening your core muscles. Core muscles and pelvic floor muscles are completely different, but strengthening your core muscles can certainly help. And sometimes that gets us really good results and sometimes it really doesn't. Other options are hormones. I oftentimes have people start hormones or bioidentical hormone replacement for bladder issues and incontinence and pelvic floor dysfunctions, just because hormones can sometimes help with the elasticity and the integrity of our vaginal tissue and our bladder tissue and elasticity and the ligaments that hold everything up in our pelvis or pelvic region. So hormones can sometimes be super helpful. Everybody knows about Kegels, right? Like everybody's doing Kegels, or I typically recommend women do Kegels when they're driving, in traffic, and every time you stop at a stoplight, do your Kegels. Every time you're stopped at in a traffic jam, do your Kegels. So sometimes those can be super, super helpful, and other times maybe not as helpful. And then there's the pelvic floor physical therapy, which can be really helpful and beneficial for a lot of people, but it's also sometimes uncomfortable or awkward or just doesn't really align with the comfort level of certain people, and sometimes that inhibits people from actually getting some of the help that they need, and that is totally fine. So incontinence is a tough subject, and sometimes it has great treatment options, and sometimes those treatment options just aren't for everyone. So one of the things that is now newly available is something called an Emsella Chair, and what it does is it actually uses like high magnetic electromagnetic frequencies that is kind of like a little ultrasound and electromagnetic frequencies that go through, and it really helps strengthen the pelvic floor muscles, and it helps reconnect and restore the neuromuscular, so the communication that goes from your nerves to your muscles in the pelvic region. And so it's super, super helpful with incontinence, pelvic floor strengthening, erectile dysfunction for men. And it's easy. It's like super easy, super convenient. It's a chair that you come to the office and sit on for 28 minutes. That's one session, and the usual protocol is 6 sessions, 2 times a week for 3 weeks, and it helps, like again, just like super easy. It's non-painful. You're fully clothed the whole entire time. Most people just bring a book and read or just relax for that 28 minutes. You can't really be on your phone because it is electromagnetic, and you don't really want to mess up your phone or anything like that. So it's a very relaxing, non-invasive, comfortable procedure, and most people notice effects, positive benefits within 1 or 2 treatments. Certainly they notice significant benefits within the 6 treatments, and it's upwards of 95% patient satisfaction, which I honestly, in medicine, I don't know that there's anything else that I've ever done that has gotten or had 95% patient satisfaction. So this is pretty incredible, and we're actually bringing one into the office because I get to talk to a lot of people, and a lot of women women especially, bring this topic up, but I also know that there's a lot of women that don't bring this topic up. So I'm super excited about having this be a viable and very beneficial option for patients to come in a non-invasive way, deal with their incontinence issues. So the offer that we have is, because it is brand new in our office and we're wanting to get some experience and some exposure and some data collection, what we're doing is for the first 30 people who want to purchase a package of 6, the package is $1,500, which is a deal. It's less expensive than physical therapy and certainly surgery. And so $1,500 for the package of 6 sessions, and when you buy that package, you also get a free package. So you buy a package of 6 for $1,500, you actually get a package of 6 for free. And you can use that package for yourself. You could use it for, you could gift it to someone that you love and know that is having an issue as well. So I always, in situations, whether it's a personal situation or a work situation, or something that is an offer or a conflict, or kind of a deal that is a conversation that's being had, I always go into the conversations with a win-win-win attitude. I want it to win for me, and I want it to win for the other person, and I want it to be a win for just the greater good or humanity as a whole. And so to me, or to us, this offer is one of those things. It's a win-win-win. It's a win for you because you get the first 30 people that do this get a really good option for incontinence at a really, really affordable price. I know that $1,500 is a chunk of change, but again, it's a lot less expensive and a lot more effective than even pelvic floor physical therapy and certainly surgery. And so it's a win for you as far as getting an effective therapy for an affordable price. It's a win for us because we'll get kind of an instant 30 people that will be able to have our experience and our exposure and data collection as well, which is really, really nice. So we can use that to continue to better the therapy and the option. And then it's a win for general the greater good, or general people in that big old bird just flew by, because it's a way for both of us, for us and for you, to pay it forward and maybe gift it to someone in need. So again, we're only doing this for the first 30 people, and honestly, I don't think that it's going to last very long. I would assume that probably within the first 1 or 2 weeks after this email goes out, it's probably going to be all sold up. But that's cool. I think that's awesome. So if you're interested, definitely either give us a call, email us, or secure message us through the portal. Let us know that you're interested and would like to purchase, so we can put you on that first 30 list. Okay, so super excited about this, guys, and I hope you guys are too. If you have any questions, definitely give us a call. If not, be happy, be well, and we'll talk soon. Bye-bye.